and welcome to Health is Wealth. My name is Joseph Cardi, and today's the program of focus is on nationalizing the health agenda of President Bola Tinubu. Of course, prior to the election, promises were made on how various sectors will be revamped and get all of them working. But our concern is on health because so much is contained in that campaign promises, where the president assures that irrespective of Nigeria's or Nigerian social status, level of income, as far as it is within the four walls of this country, healthcare services will be provided for such a citizen at no cost, depending, however, with the level of care that the person needs. But however, that provision of healthcare services at the primary healthcare level remains free, and anyone who accesses the primary healthcare centers will be given free treatment. And the primary healthcare centers, and of course with what we knew about the cashback of the basic healthcare provision fund, which is extraction of the National Health Act passed and signed into law in 2014 by the then President Goodluck Jonathan. There are many gateways where monies are provided aside the annual budgetary provision for health ministry. There is the basic healthcare provision fund, which has to do with 1% of the country's consolidated revenue. That 1% is given to three gates, which is the primary health care, the National Health Insurance Authority, and of course for health emergency. For the primary health for the NHIA is 45%, and the emergency services take 5%. Out of that 5%, we now know that the NCDC, the Nigeria Center for Disease Control, is taking 2.5 of the 5%. And to ensure that these things work well, we have seen that President Bola Tinubu, to an extent, is having those monies released for all the gateways. I think the last one, over $1 billion was released for that purpose, and it is done on a quarterly basis. And states are supposed to benefit from this money by way of paying their counterpart fund and also having offices for that purpose. And to look at the primary health care, the president had so many issues to address when it comes to the primary health care, which has to ensure that women go to primary health care centers for antenatal service, ensure that they deliver at the health center, and after delivery there is also a follow-up, which of course we know as postnatal services. It is also there for basic health services, which has to do with routine immunization when the child is giving birth to at the health facility, the primary health care facility. So the child must be provided with all the bodyguards, which we know as immunization, the BCG, the polio immunization, the tetanus immunization, the measles immunization. The list is endless. It is taken from birth to about 1 year and 6 months of age. That is enough bodyguard for the children and or for the child to ensure that he or she don't come down with minor illnesses or even preventable deaths, preventable death. And of course, at the primary healthcare center is where basic services are provided, such as diagnosis for malaria, for TB, for hepatitis, and many other, of course, diagnosis that we know of. So that in all that the President Bola Tinubu administration is doing, it is apt for monitoring and evaluation. the monitoring and evaluation, which of course has to do with inspection, is what the Office of the Special Advisor to the President on Health, Dr. Salma Anas, carried out just recently. It is just to inspect the nationalization of President Bola Tinubu's health agenda. And of course, Suleja just said is just a stone throw from the nation's capital, and so much was seen there when the inspection was done at the basic healthcare facility domiciled at the primary healthcare center in that particular axis, where the maternal and child health center was inspected, the laboratory was inspected, of course pharmacy was inspected, the whole building was inspected, and this is what we have at the end of the day. So let's take a look at what Dr. Salma, who is the special advisor to the President on Health, has to say when it comes to ensuring that the state or subnational get to see that the primary healthcare functionality is achieved to the desired goal. Let's take a look.
On behalf of President Bola Tinubu, I'm following up the campaign promises. I'm following up the commitment he has demonstrated in the last 2 years to see what is happening at the grassroots level. Because we promised the grassroots pre-election that we are going to ensure the health of women and children. We are going to strengthen the primary health care facilities. We will ensure that essential medical services are there, and basic medical obstetric services are also available. So we decided to come here today in partnership with Niger State government, because Niger State governor is one of the governors also in the North Central state. We are visiting all the states of the regions of the Federation. The Niger State governor is one of the governors that has demonstrated so much commitment also in the last 2 years. And he has also fully aligned with the aspirations and priorities of President Bola Tinubu. So we are here to see for ourselves and also to identify what are the few challenges so that we can make things better in the next 2 years to meet our commitment. And to God be the glory. What we have seen here is amazing. It's very encouraging, and it has shown that we are operationalizing the commitment of President Bola Tinubu. The governor of Niger State has taken it and is implementing it, and this is seen for believing. We've seen the primary healthcare center has been revamped, has been strengthened. You can see women here, over 200 women attending antenatal clinic. This does not just happen, it is as a result of intensive awareness creation, as a result of intensive advocacy with traditional institutions. You can see we have the traditional leader with us, and also religious leaders. So this is what the state government has demonstrated, because this is their own responsibility to mobilize and create the demand for services. We've seen all the essential drugs available in this facility, including family planning commodities, which President Bola Tinubu has remained committed to the procurement of that commodity. And he has been doing the disbursement as well as disbursement of other commodities through BHCF. But what is most amazing, Honorable Commissioner, that I saw, Niger State is one state that has a budget line and is also procuring family planning commodities. Because they believe, just like we believe, based on evidence, that family planning commodity is a game changer. It saves lives of mothers and also that of children, and impact positively on national development. So kudos to Niger State, and we appreciate the governor of Niger State, who is really a champion of health, and this is what he has demonstrated today. So it gives us opportunity also to enlighten the women and come into contact with the women. But of course there are takeaways, there are few challenges, and one of the challenges I saw is the infrastructure is so small and limited to them. So we are going to take that up and explore opportunities of how we are going to expand and then upgrade this facility to a higher level where they can accommodate more women. One of the limitations that I did mention in terms of the infrastructure, the whole infrastructure is inadequate. It cannot accommodate the large number of women. Almost 200 to 300 women per day are coming here. They are being delivered here. They are receiving their immunizations here. In addition to treatment of other minor ailments, even men are not left behind. They also attend to men that have come here with basic illnesses. So taking it forward, we are going to explore opportunities. We are going to advocate. We are going to mobilize resources to ensure that this facility is upgraded. That will provide basic minimum requirements in terms of infrastructure, laboratory expansion, the labor room expansion, the antenatal clinic expansion, even the postnatal clinic extension, and plus immunization rooms. So those are areas that we are going to work together in collaboration with the state government to ensure that we expand these facilities and make them happen. So I have to speak in vernacular so that they understand what it means. Thank you so much. So for me, I have seen excellently they are operationalizing the policies that we are developing at the national level. They are operationalizing the aspirations, the vision, the priorities of President Bola Ahmed Tinubu. This is what we are seeing. So I can only say, for me, he's one of my best governors. Second to Governor Zulu, of course. So I really appreciate him. And it's a place I want to come and do more. Because I have seen that commitment. You can only do more when you have a leadership, a governor that is committed. So I promise the Honorable Commissioner, I'm coming and we are going to target other populations, like the younger populations. We are going to do programs to ensure that young people also align their health, in terms of health promotion, adoption of healthy lifestyle, as well as sexual and reproductive health. So I want other governors to learn from Niger State, to see what is happening in Niger, so that we can have a better Nigeria and a better future for our children. So essentially what I told them about is the importance of maternal, newborn and child health. And I appreciated them for all of them to come to the clinic. The importance of knowing very early when you are pregnant, and when is even the right time to get pregnant. You have to be prepared for it. You don't just get pregnant by accident. As soon as you are pregnant, you must come and register for antenatal clinic. I told them that it gives them opportunity to assess their health through screening, and also to know their status, including their blood pressure, including HIV status. So it starts from there. And they continue to do this throughout the lifespan of that pregnancy. So it helps them to remain healthy and detect diseases very early and avert it. Then secondly also, it helps with the children, with the baby that are unborn, to know the status of the baby and to guarantee the health of the baby, both physically, mentally, everything about the baby. So those are the things I told them to ensure they do that, and to ensure the most important part of it, they come back to the facility and deliver. Because we lost majority of women at the point of delivery as a result of bleeding or high blood pressure, which results in eclampsia, or obstructed labor or the infections. So that is the cause of the matter. After doing all the antenatal, it's not enough. You must come back and deliver your baby by a skilled birth attendant. And I appreciated the sister here doing a great job. She's a sister that does not only deliver women because there are beds or no beds. She ensures that every woman that steps into our facility is delivered by a skilled birth attendant.
Yeah, we heard from Dr. Salma loud and clear. We don't get pregnant by accident. We prepare for it. And when eventually we are pregnant, we visit the primary health care center for antenatal. That gives the doctors, nurses, and of course health workers there to carry out series of tests from you. The HIV tests, if you are positive, of course, the care for you is further increased if you are not fine, and then sugar tests and several other tests will be done. And while you still go for your antenatal, the position of the baby is also determined so that you will have a normal delivery. And even after that, at the time of delivery, you should not go to traditional birth attendants. You still have to come back to the facility for delivery. And after that, it follows with postnatal routine immunization for your baby up to 1 year and 6 months. So it's very important that we emphasize this so that when we put to bed, that child needs to have all the necessary available bodyguard to ensure that the child get to full potential. Away from that, let's hear what the Commissioner for Primary Health Care, Niger State, has to say when it comes to the challenges that were mentioned, which has to do with the limited space of the facility, which of course may be a replica of other facilities, and the need to have some of these facilities expanded, especially when you look at the budget line created and the continuous assessment of the basic healthcare provision fund. So there is need for expansion, especially when the population is growing. Let's take a look at what Dr. Ibrahim Dangana has to say when it comes to the issue of expansion.
Structure-wise, it is in a very good shape, very clean, very good structure, and of course, as the state government is putting the resources, we are also reaching out to various partners to complement what the government is doing. Recently, we are aware His Excellency, the former governor, had laid foundation stone for the building of 100 million and this is one of the facilities we are looking at, but the concept we have there is a time for space. So we are reaching out to the world to see if we can secure a new big space within this world so that we can do a state-of-the-art level 2 that will include staff quarters. So in terms of revamping the healthcare system, the governor is very, very determined about it. Currently, 20 will be ready for commissioning next month, and other renovations are going on in conjunction with other partners, including the Federal Ministry of Health, National Primary Care Development Agency, and other partners. So this is big for here. We have more than 50 full-time staff here, more than 50. In fact, if not for the fact that it is a high-volume facilities, as you can see the turnout from women today, we will have even want to take off some staff here and redistribute to other areas. But they provide essential services to a large number of people within this ward and other surrounding communities. But in terms of manpower, Mr. Governor is also doing the best he can. Recently, we have recruited an additional 1,500 healthcare workers, which we have injected into the system. They will be coming on board as we commission these 100 level 2 facilities that are currently ongoing on the state. So for here, we don't have manpower, but in other areas, there are challenges of manpower. But to mitigate that gap, what is why Mr. Governor gave an emergency waiver for us to recruit additional 1,500, which we have distributed already into the system. Well, we want to appreciate the coming of the social advisor on health, Dr. Salma Anasolo. We are very delighted to have her here. To see how to witness first-hand TAC in action in the other state.
Yeah, so that is another testament of nationalizing the health agenda of President Bola Tinubu, which of course has to do with expansion. There is no reason why the structure should remain the same. There is no reason why the equipment in the hospitals cannot be replaced. There is no reason why more equipment, of course, ultra-modern ones, cannot be procured, especially when the president is simply releasing money through the basic healthcare provision fund gates, and of course the state government is also creating budget allocation to ensure that healthcare is taken seriously. And this goes to every other state as far as the country is concerned. And this is where, of course, we wrap up to this edition of the program Health is Wealth. My name is Joseph Kabi. See you some time.